Allison, I'm still troubleshooting with our Vietnamese interpreter, so if they join in, if you could just keep an eye out to link into the language.
Thank you, Karina.
Good afternoon, everyone. Thank you for joining us. We will go ahead and take another minute or so while we wait for our participants to join. For those who have joined in, we are doing this webinar style, so participants are able to ask questions through the Q&A feature, but do not have access to microphone or cameras, just to clarify. All right, well, with that, we would like to go ahead and get started for our provider information session of tonight, February 1st. Thank you again, everyone, for joining us. We know that it's difficult times and you take some time to join us even after some very long days working with families and children. So again, thank you. We want to make sure that listeners who are joining us and who need interpretation are able to link to their language. So with that, on the following slide, we will show how to do that. We can see a visual. Next slide, please, Don. On this slide, we can see on the bottom corner, on the bottom of your screen, if you're on your phone, it will look like on the right corner, I believe it is, there's a little globe, and you go ahead and select that globe, and it will allow you to select your language. Si nos está escuchando en español y puede ser ahorita el enlace a su idioma, puede seleccionar el globo y elegir el idioma en español. And we have our Spanish interpreter here, as well as our Cantonese interpreter. For those who might be waiting for Vietnamese or Russian, we are troubleshooting currently. So thank you for your patience. All right, and with that, for tonight, just a quick debrief of what we'll be covering tonight. We'll be going over a check-in on new COVID guidance with OHA. As some of you have seen, there are a few updates to this guidance, so we're pleased to have OHA members join us today. We'll also give a brief update on the Child Care Stabilization Grant Awards and where those are, and we'll end with agency and program updates. We'll go ahead and get started first with information regarding COVID-19. I'll go ahead and introduce my colleague, Miriam Cecilia, who's here with us. Thank you, Miriam, for joining us.
Hi, thank you. And thank you for everyone that's joining us tonight. We do have some COVID guideline updates. On Friday, the Centers for Disease Control updated child care sector guidance for COVID-19 response. So we've been working as quickly as we can with Oregon Health Authority to update our guidelines. Child care update went out today. You would have seen it via email, and on our website, there are FAQs. But we've also invited some folks from Oregon Health Authority to go through the guidance with us today and discuss the Omicron surge and how it affects childcare. So tonight we have Dr. Meg Carey, who's a senior health advisor with the Oregon Health Authority, as well as Niti Vyas, who is an epidemiologist with the state. So thank you so much for coming, and I'll let them take it from here. And we will also have time to answer questions.
Hello all, good evening, and thank you so much for inviting myself and my colleague Niti to your conversation this evening. And many of you, I appreciate, may have already talked to Niti. She provides the infection control and prevention consultations around the state for childcare settings. So we are, it goes without saying, in a surge that has dwarfed all other surges to date in our COVID pandemic. The Omicron surge has very quickly ramped up to the highest number of daily cases that we've seen, and is closely approaching the same number of individuals requiring hospitalization for COVID as we saw during our Delta surge. Similar to the national and international data, we are seeing here in Oregon that the Omicron variant, fortunately, is not associated with more severe illness than the Delta variant was. We are seeing, though, during this surge that there are increasing differences among infection rates among those who are vaccinated and unvaccinated. Currently, about 70% of individuals who are contracting COVID are unvaccinated, and an additional 20% are vaccinated but not boosted. Next slide, please. There are signs that this Omicron surge is slowing in some communities. This is data of the pediatric COVID cases, and among all age groups and kids, there's also some signs that the rate of increase in infections is slowing some. The graph on the left shows COVID cases disaggregated by age, the 0 to 4-year-olds in the lightest blue line at the very bottom. And as has been the case throughout this pandemic, it seems that our youngest children are protected a little bit against COVID, which is incredibly reassuring. The graphs on the right show that we still have a long ways to go to address racial and ethnic health disparities. While we were making some progress earlier in the pandemic with this surge, once again, there are significant disparities among our Black and Brown children who are contracting COVID in contrast to our white children. Next slide, please. And also, there continue to be differences in region regarding the number of individuals who are contracting COVID. The darkest zip codes have the highest rate of COVID infections per 100,000 of their population. And this graph is changing over the course of this pandemic. There are some regions like in Northeast and in Portland Metro that really seem to be slowing on rates of increase in COVID, whereas in Central Oregon, there still are increases in case counts. Next slide, please. And again, getting back to the question of breakthrough infections, there are absolutely more individuals who are experiencing breakthrough. and that is our 3-year-old who paid me a visit. So there are definitely more breakthrough infections that are happening with this surge, as we would expect. And one of the things that we are seeing is that vaccine effectiveness wanes after 4 to 6 months for those who've had the mRNA or the Pfizer and Moderna vaccine, and after about 2 months for those who've had the Johnson & Johnson vaccine. We don't know the total number of breakthrough cases in Oregon because there's a lot of people who have mild symptoms or no symptoms or haven't been able to access tests, and so they don't know they have COVID. But looking at this graph on the left, the yellow line shows the individuals who are unvaccinated who are contracting COVID in comparison to those in the blue line who are fully vaccinated but not yet boosted or up to date in their vaccines. And the gray line is those individuals who are up to date in their vaccination status. The chart on the right just shows from national data, which is playing out similarly here in Oregon, the risk of both contracting COVID and becoming hospitalized for COVID or dying from COVID, and how the risk increases among those who are unvaccinated. Next slide. So, to the updates in isolation and quarantine guidance, we so appreciate your patience. We were all trying to figure out how best to manage mitigating infection while also relaxing the isolation and quarantine guidance with the new data that was coming out around the Omicron variant, that it seems that people who get COVID get it earlier in their illness. And so the need for as long of an isolation was in question. As Miriam said, we were waiting for the CDC guidance and we didn't want to get ahead of the CDC, but fortunately we had been thinking and having conversations internally. So when the CDC submitted its guidance on Friday, we were able to respond really quickly. And this is a table describing what our new recommendations are for isolation and quarantine in the childcare settings. We are aligning with CDC for the most part, such that if there is universal masking in the classroom, both staff and children are welcome to isolate for 5 days and then return to school for 5 days wearing a well-fitting mask. The same for quarantine. If staff or if there are older children who are up to date on their vaccination, they do not need to quarantine, regardless of whether there's masking in the classroom or not. For classrooms where there is not universal masking, including classrooms with children younger than 2 years where we don't recommend universal masking, or if there is a mix of children who are masked and unmasked, we recommend that staff and children complete a full 10-day isolation. And for those who are not fully vaccinated or up to date on their vaccines, complete a full 10-day quarantine before returning to the classroom. And this is to reduce the risk of transmission among a population of children who are largely unvaccinated and not wearing masks, and also because we appreciate that it's really hard to ask a single child to wear a mask all day long if their peers are not also wearing one. If you're providing care out of your home, if there are children from outside of your home, but your home wears masks, then a 5-day isolation with 5 days of wearing a mask is reasonable. And for if there is a household member who has contracted COVID, other household members should start their quarantine after the end of that household member's isolation period. The other big population, of course, is before and after school care associated with K-12 settings. We appreciate that in K-12 settings, the guidance for isolation and quarantine changed earlier to reduce to the 5-day isolation and quarantine and 5-day of wearing a well-fitting mask, and the childcare guidance aligns with that. Importantly, though, for childcare, we ask that in those before and after school related programs, students follow the general population isolation and quarantine. There's two differences with CDC that I want to make sure to underline. The first with following the general population isolation and quarantine versus the K-12 guidance is that in K-12 guidance, it is now not considered an exposure if there is universal masking and a child was exposed within 3 feet of contact. So if there was a child who was within 3 feet, but there was universal masking in that classroom, that is not considered an exposure for quarantine. Because in after school and before school age programs, it does not have the unique protections of staff vaccination and universal masking. We're asking that exposures, or you will still be considered exposed if you have been within 6 feet for greater than 15 minutes. So that's still the general population guidance. The Second, if you would not mind going back one slide, Don, thank you. The second big difference from the CDC guidance that we want to highlight is that the CDC guidance in childcare currently states that regardless of whether there's universal masking in the classroom, if somebody can wear a well-fitting mask, they can return to the classroom after just 5 days. And again, we are recommending that that only happens if there is universal masking within the classroom. That is, if all the staff and all the children are masking for the increased protection as well as universality of kids wearing the mask. Thank you. Next slide. All right, so the detailed implementation of this guidance, ideally for snacks and meals at all times, children and staff will be spaced 6 feet apart. We appreciate that that is not always feasible in every childcare setting. And so 6 feet of distance is not possible during snacks and meal times. And we recommend that you create small, stable mealtime cohorts of kids so that if there is some exposure, it will have less likelihood of spreading to the entire class. Children and staff who are returning after 5 days of isolation or quarantine may continue to eat with their typical cohort, and they don't require additional separation, even though we appreciate that they will have to remove their masks, obviously, while they're eating. And lastly, the definition on up to date. So this is in alignment with the CDC, and it follows their updating of the vaccine definition, or the up to date definition for vaccination. And this is for adults 18 years and older that they have either had a booster dose or they are less than 5 months out from completing both doses of their mRNA vaccine, their Moderna or Pfizer vaccine, or less than 2 months out from completing their Johnson & Johnson vaccine. So essentially either they have their booster dose or they're not yet eligible for a booster dose because they've completed their vaccine so recently. For 5 to 17-year-olds, up to date on vaccination means simply 2 weeks after completing their vaccine series. So for youth, it's not required they be boosted to be considered up to date on their vaccination. And again, the importance of this is that individuals who are up to date on their vaccination do not need to quarantine if they have been exposed. And there's no change to that guidance. Lastly, we appreciate that even with this shortened guidance, or in classrooms where there's not universal masking, for example, in classrooms of infants and young toddlers, if having staff isolate or quarantine would result in closing the classroom, programs may consider contingency staffing strategies. They can determine what strategies would best fit their program and are the safest in consultation with their LPHA, and then obviously in consideration of any unique risks of the children or staff that they're working with. We appreciate that for some programs who serve children with complex medical needs, that the consideration of a shortened isolation or quarantine may carry more risk. And obviously we'd start with shortening quarantine because there's less risk in shortening quarantine. Next slide. And just 2 sites, I'm sure many of you are very familiar with these, but if anyone in your program is having trouble locating where they can get a COVID vaccine or a booster dose, please go to covidvaccine.oregon.gov. And in addition, I recommend that you, if you have not recently, look at safestrongoregon.org for not only information about COVID vaccine and its safety, but also tools and resources to support your emotional health and well-being and additional community resources. We appreciate that this pandemic has been arduous and are so grateful for all of the work that you're doing to help take care of kids and families. And as a mama of a young kid, I just cannot express my gratitude enough. So thank you. And then lastly, if it's helpful, this is a link to a CDC graphic that shows the effectiveness when there's universal masking in reducing the spread of the COVID virus. And additional COVID resources and information.
Yeah, just as a reminder, we have our OHSU child care provider nurse hotline here for questions about COVID-19. You can request test kits from USPS using this link here. And as always, please refer to FAQs and guidance documents on our website.
Thank you, Megan, Miriam. And we have Ronnie here to help us facilitate some of the questions coming through. Thank you, Ronnie.
Thank you, Karina. So there's questions about masking. Could you please clarify the masking at meal times, nap times? What are the times that they can take off their mask? Sorry.
Thank you. So kids should take off their masks during meal times and while sleeping, same as always.
Okay, thank you. So should the programs continue to report to their local health department anytime that there is COVID in their settings?
Yes, please.
Yeah, providers are still required to report to local public health anytime there's an exposure and to notify families in the need for them to quarantine. And when you do contact local public health, they're going to give you the best, most direct guidance regarding quarantine timelines.
Thank you. So for in-home providers, does it matter what type of test the family uses? Like if they use a home test, or do they need to get an official one from the doctor to show that they no longer or they don't have COVID?
So I want to make a clarification. Thank you so much for that question, because it gets to a lot of really important points. There is any test is appropriate for testing to see if you have COVID. So an antigen test, an at-home self-test, a PCR test that you get through a testing site or from your healthcare provider are all considered, we take the results of those tests as a result. So there's not a need, if you do a home self-test, for example, to get confirmation by a PCR test. So any type of test can be used to determine if you have COVID, if you've been exposed, or if you're symptomatic. In terms of using tests to determine if you still have COVID, we actually don't recommend using tests as a way to end your isolation period. Rather, we recommend using the time-based strategy. So 5 days if you're able to wear a mask in a classroom where there's universal masking, or 10 days if you're working with very young children or there's not universal masking in your program. And the reason for that is that tests can remain positive at the tail end of your infection, even if you're no longer infectious and able to transmit virus to others. So while they're very accurate in the early stages, particularly if you're symptomatic, they're less useful at the end of your infection. So we recommend using the time-based strategy to end your isolation.
Thank you. So if a classroom of infants, if there was an exposure in a classroom of infants, then the entire room has to be quarantined. Is that correct?
Yes.
Okay, thank you. Somebody wanted to hear a little bit more about the contingency for staffing that you had mentioned. Can you talk about that a little bit more?
Sure. So I don't want to get into too many details, because the details will need to be worked out in accordance to your particular circumstances and in consultation with your LPHA. But in short, we understand that even an isolation or a quarantine for 10 days may result in staffing shortages such that your program would have to close. And we very much appreciate the need to balance continued access to childcare with the risk for reducing infection transmission. And so if your program is at risk of having to close because of a staffing shortage, for example, then work with your LPHAs to consider a stepwise approach to bringing staff back. For example, we'd recommend starting to reduce quarantine for staff who are fully vaccinated and boosted, who are up to date in their vaccination. The second step would be to introduce back staff or shorten the quarantine period for staff who are wearing a well-fitted mask, but they may be in a classroom where there's not universal masking. So obviously, if you're exposed to COVID, there's no guarantee, even with Omicron, that you will get COVID. And so bringing back staff who are in quarantine earlier can be an effective and relatively safe way to continue to keep your programs open. And please let me know if that answered your question or if you have additional questions on that.
Thank you. So when they're reporting COVID exposures in their facility, who do they call? Is it their local health authority, or they're also calling their nurse line? Who do you suggest?
That would be the local county public health authority. And if you are having trouble locating that contact information, you can email us at providercontact@ode.oregon.us and we'll help you locate it.
Okay, thank you, Miriam. Do you have any additional guidance on outdoor masking for preschool age children when they're outside?
Outdoor masks are not required. Meg, do you want to add anything?
No, but just be longer to, yep. Thank you.
Okay. What are the best masks for children to be wearing at this time, and where can we get them?
The best masks are well-fitting masks that the children will wear. And I don't mean that glibly at all. That a mask that is comfortable for the child, that they can wear, that fits as tightly as possible around their nose and their mouth, really is the best mask. There is not great evidence that a KN95, for example, or double masking is particularly better for young children, particularly if it results in them being uncomfortable, them not being able to wear it well. So a well-fitting mask is the best for you. And you know, obviously every face is different. And so it may take trying out a couple of varieties to find the right one for your child. But I imagine that the wealth of knowledge in this group about the masks that they have found work well would far surpass any suggestions that I have.
Okay. So for in-home childcare programs, do parents still need to mask at drop off and pick up?
That's not a sorry. Go ahead, Meg.
No, please, Miriam.
That's not a requirement of the Oregon OSHA. If they're, I'm sorry, Meg, do you have anything to add on that?
Nope, that's exactly right. So again, you know, if it's an outdoor drop off and pickup, then masks are not required. I think it is recommended, and as one of the health advisors, it should come as no surprise that I'm going to strongly recommend that caregivers wear masks, just because it helps to reduce the risk, but is not required if there's outdoor drop off and pickup, or if there's a very quick and short drop off and pickup exchange between the caregiver and the child care provider.
Okay, thank you. If there is an exposure and the child or the adult tests positive, but they don't have any symptoms, do they need to isolate for 5 to 10 days anyway?
Thank you for that question. That's such an important point to raise. Yes. So if you test positive, even if you don't have symptoms, and we know that there are individuals, unvaccinated, vaccinated, boosted, who can have COVID with very mild or remain asymptomatic, they are still COVID positive. They are still potentially transmitting and infecting others with COVID, and they absolutely need to do an isolation period. So again, 5 days or 10 days, depending on the masking in the classroom. And I wanted to make one clarification. I fear I may have been confusing, but I wanted to take a step back that for childcare settings, exposure So the definition of a close contact remains what it remains for the general population and what it has been for the duration of this pandemic. If you are within 6 feet for at least 15 minutes over a 24-hour period, you are considered exposed and you should quarantine according to the guidance.
Thank you. Can you talk about the symptoms? Have the symptoms changed at all from the very beginning of COVID to now the Omicron?
You know, there have been reports that some symptoms, like people losing their sense of smell and taste, hasn't been as frequent with the Omicron variant. Some people aren't getting as sick with the Omicron variant. Maybe they're not having a fever in the same way. So the experience of the symptoms may be different, but fundamentally the symptoms have not changed. And our definition of the primary 11 COVID symptoms, 12 COVID symptoms, it's been a while since I've counted them, remain the same. So there are no substantive changes to the symptoms, and the full range of symptoms are still possible, even with the Omicron variant.
Thank you. If a child or an adult has had COVID in the last 90 days, do they have to quarantine if a class has been exposed?
Thank you. I did put that in the table, but I didn't say it out loud. So either being up to date on your vaccination or having had a COVID positive infection within the last 90 days excludes you from having to quarantine. And so that would be the case for children as well. And my colleague Needy, I don't know if there's anything that you wanted to add to that. So again, staff or children, if they've had COVID within the last 90 days, they do not need to quarantine if they have been exposed to COVID. If they become positive for COVID, even if they had COVID in the last 90 days, they will need to isolate.
Okay, thank you. I'm not quite sure who this question is for, but do providers have the right to test a child without a parent's consent?
No, for children under the age of 15, you have to have a parent or guardian's consent. Miriam, any other additions to that?
No, I don't have anything to add.
Okay. Would individuals be able to find the COVID symptoms on the website for OHA?
Yes, and I can look up a link and put that in the chat as well.
Thank you. So if a family member tests positive, how long does the child in care quarantine? Oh, that question's, I'm sorry, the questions, I'm not understanding this correctly. If a family member tests positive, how long does the child care have to be quarantined for that?
So I'm going to lean on my colleague Niti, but let me start us off. So if there's a household member who has tested positive for COVID, then the quarantine period for the other household members starts after that household member has finished their isolation period. So after 5 days, or on day number 6. Presuming that household member who was positive will wear a well-fitting mask for the remaining days 6 to 10 of their isolation.
Okay, thank you.
Needy, anything to add to that one? Okay.
Thank you.
I'm sorry. Hi, this is Neeti. I was trying to unmute and for some reason I wasn't able to, but that sounds about right. I think we're just talking about as long as they were able to isolate themselves completely, and if that's not possible being a household exposure, then the quarantine period starts the day after they finish their isolation.
Thank you. Do programs need to exclude children with runny noses?
That depends. So if a child has a new runny nose, then it's probably a good idea to exclude that child and have that child tested for COVID. And if that child is determined by their healthcare provider not to have COVID, then that child can return after the symptoms are improving. So that's really a conversation with the child's healthcare provider.
Okay, thank you. When should caregivers in childcare programs test for COVID?
Another great question with no straightforward answer. And I just will acknowledge that there are certainly other infections going around that are not COVID, and allergy season is starting. So starting to distinguish what is a COVID runny nose versus a runny nose from something else can be tricky. And if the runny nose is chronic, then you can probably be more reassured that it's not COVID, but certainly people can have a runny nose from allergies and they get COVID on top of that. So sort of the safest option is to check with their healthcare provider and to get them tested. So this leads to the question of when to test for COVID. So if somebody is having symptoms, it is a good practice to get tested for COVID if you can have access to the tests. I appreciate that it is harder to get access to tests, but hopefully you're able to contact the government and have some test kits mailed to you. Also, if you've been exposed to COVID, then it can be effective to test 3 to 7 days or 5 to 7 days after your exposure. So we know that particularly antigen tests are those tests that you can do at home. The self-tests at home are antigen tests, and they are more accurate if you test when you have symptoms, if you have been exposed, and if you've waited a couple of days. They are less accurate in the very early days of exposure and when you may be asymptomatic. And Needy, anything to add to that?
No, I don't have anything. Thank you.
All right, thank you.
Thank you so much, Ronnie, Meg from OHA, and Miriam, who's joining us from ELD, for answering all of these questions. I do want to just kind of take note of time and where we are. So Ronnie, how about we do one more question and then we can transition over to our next topic, which is childcare stabilization grants. But we can also, if we have any spare time towards the end of this call, we can come back and answer some of these questions. There is an option for folks on the call to upvote. So if there's a question that you see on the question and answers coming through that you would really like to have answered, go ahead and give it a little thumbs up, and that will kind of indicate to us what some of the most pressing questions are if we haven't already gotten to it. And with that, actually, Ronnie, if you want to do one more question, and then Alyssa, we have a slide after this that we would like you to share with us.
Thank you, Karina. Miriam, do the programs still need to record who is dropping off and picking up the children?
Programs still need to follow the regular licensing rules regarding attendance. So they would record mom or dad or grandma, and the name is not necessary, but who is dropping off and picking up is a part of the regular licensing rules.
Okay, thank you so much.
Thank you, Ronnie. And since we have our Zoom webinar streaming to the Facebook, I do want to acknowledge that we have received a couple questions on there. And there is a question that says, for school district run programs, are we required to follow ODE or ELD guidelines, specifically for staff? They're not aligned. Which one should we follow?
So that's a great question. Meg, feel free to chime in, but well, actually, I can let you answer that. You probably know more than I do.
No, I actually didn't understand what kind of program it was.
It's not clear. It just says for school district run programs. So
school district run
okay.
programs. Thank you.
Yeah.
So for school district run programs, they should follow the K-12 guidance.
Perfect. Thank you so much, Meg and Miriam. And we have just one more slide after this, and I believe we have seen some questions come in about testing. And we have Alyssa Chatterjee, our ELD director, to kind of walk us through where we stand with testing kit distribution.
Thanks, Karina, and thanks again, Meg and Miriam. Yes, so we know that access to testing kits has been a challenge. So the Oregon Health Authority was able to order approximately 6 million COVID tests For the first time, they were able to set aside a limited amount of those tests for early learning, which we were really excited to hear. However, there were not enough testing kits to make them available to all childcare and early learning providers. These testing kits are going beyond early learning. They're going to K-12, to healthcare programs, community-based organizations. And so at this time, only a few program types are able to receive kits. Those are our organ to prenatal to kindergarten or Head Start programs, our preschool promise programs, and our relief nursery programs. We're continuing to work with OHA as we identify additional supply of testing kits. We'd like to get to a place where we can make testing kits available for free to all childcare providers, regardless of whether you participate in a public program like Preschool Promise. And so we will share more information if we're able to move forward with something like that. But just wanted to acknowledge we need to get tests to you all. We're working hard to do it. If you've heard about testing being available right now, it's only being provided to these few programs listed here.
Thank you, Alyssa. That's been a big question that we've seen it come through tonight. So just wanted to acknowledge that, and also just want to acknowledge some of the comments that we've seen, right? Understanding that it's just very difficult to keep up with. Changing guidance has been a frustration for several, and we've just really tried our best to make information available in a timely manner and make it as accessible and understandable for everyone. So we're happy to have you all join us today and ask all of these questions. With that, we will go ahead and transition over to childcare stabilization grants. We have Dawn with us for a quick update.
Hi, good evening, everybody. Nice to be back with you in this virtual format. Wanted to provide you an update on where we're at with the childcare stabilization grants. Important to note that the application period has closed. And so we were able to approve 3,360 grants, and 222 were not approved. On this graph here, you can see the numbers. 601 ODHS license exempt programs received a grant, 1,040 registered family, 839 certified family received a grant, and 900 certified centers were able to receive a grant. When we look at what that means for license exempt ODHS providers, 84% of those that we believed were eligible received a grant, 99% of registered family, 98 of certified family were able to receive a grant, and 99 certified centers were able to receive that grant. There's been a couple questions that we've been getting asked, and wanted to take this opportunity to share that information. We've received a lot of questions in terms of when you're going to receive your 1099 form for any grant funds that you received. And on January 31st, the Department of Administrative Services mailed those out. And we have heard of several people who have received those. So if you haven't received it, I would anticipate you should be receiving it sometime this week. As I said, they were mailed January 31st, so just yesterday. Additionally, we get a lot of questions in terms of when do I get my second payment? And so to remind people, if your grant agreement expires on April 30th, you will be issued your second payment by the end of February. And so if your grant agreement ends May 31st, you'll receive your grant agreement by the end of March. And then June 30, if that's when your grant agreement ends, you'll receive it by the end of April. So those are just some common questions that I wanted to kind of address at this opportunity. Still, there are these resources, even though the application is closed, We still have resources on the Early Learning Division Stabilization Grant webpage. There's a grant sample, some tools that the Federal Office of Child Care created, as well as the funding opportunity if you need to refer back and remind yourself maybe of what allowable expenses are and things like that. So we've left that up for you. We are still monitoring and answering questions in the ECC grants and phone messages that come in. So continue to send your questions there. And we also, your local child care resource and referral is available to help in terms of record keeping track of your receipts and for the 6 years that you're required. And there's also the grant helpline phone number that's still open if you have questions. Again, even to get ideas of how maybe you want to use those funds, and talking through it with a partner. So with that, that's the update that I have, and I'm happy to take some questions, Ronnie.
Thank you. Are the stabilization grants funded with federal dollars or state dollars?
They're funded by the American Rescue Plan Act funds, so those are federal dollars.
Thank you. What will happen to the funding that is left over from the funding source?
Yeah, right now we're actually looking at what the best way is going to be to disperse the rest of the funds. We will have some that we're not obligated. As you may know, we wanted to be sure that everyone who applied by the date, by the December 31st date, would receive their full funding. So we have some left. So we're right now in conversations with our procurement shop leadership to determine the best way to administer the rest of those funds.
Thank you. When will the grant funds be issued if they just got approved?
So it would be during the 4th month of your grant. So if you just received your grant agreement and it was June 30 is your end date, you would receive your second payment sometime in April, by the end of April.
The 1099, can you explain what that is in relation to their taxes?
Yeah, so because you received funds that were from the federal government, so you maybe received other grants, emergency grants that we put out, you will need to receive a 1099. It's a tax form. And I think it depends on your type of facility. I know some of them are 1099 miscellaneous or 1099 NEC forms. And so you will need to use that form to file your taxes.
Thank you. Dawn, can you explain where they can find their end date on their grant agreement?
Yeah, happy to. So you signed your grant agreement through DocuSign. And so you can go back and log into DocuSign and view your grant agreement. You may want to take that opportunity to print it off. So if that's easier for you to find it, but that's where you'll find your end date is in that grant agreement.
Thank you. If you use the grant money before the expiration date, then does that mean that your commitment to meeting all the grant requirements have also ended?
No, the grant agreement holds you for that full time period, whether you've expended all the funds or not. So for an example, let's say that you used all the funds, but you ended up having to close before the end of your grant agreement. We would need to look at how to recoup some of those dollars, because you are required to stay open that full time. I would say though, however, but we do recognize the temporary closures, and that is a part of your grant agreement. And I think particularly with the surge of the COVID surge that we've been talking about, we definitely recognize that there's going to need to be some temporary closures, and that will not affect your grant award. It would be any type of permanent closure.
Okay. And Dawn, can you talk a little bit about that 4th month when they get their second grant? where they can find the information of what would be their 4th month? And does that mean, is that the 1st of that month, the 2nd of that month, or what day is that payment going to come out?
Yeah, because there is a high volume of payments, we're saying that you will receive it in that month period. So you will receive it by the end of the month. As we send out batches, you may receive, it mid month. So if it's April is your 4th month from when you signed your grant agreement, then you will, or when it was executed, you will receive it by the end of April.
Okay, thank you. Can you use the grant money to pay for past loans that you used for your childcare setting?
In your grant agreement, it talks about what allowable expenses are. And so I would have you go look at that and see if that falls within those categories. We can work, I can provide you a little additional guidance. I don't have it up in front of me to look at the allowable expenses right now, but you really need to look and see where that would fall in there to determine if it is allowable. If it was for the childcare expenses, it would really depend what your loan is for.
Thank you. This isn't particularly about the stabilization grants, and it was also a question that was asked about the COVID guidelines. Will these slides be available on the website or at any location for people to go back and look at?
I will let Karina, I think, can answer that, or Allison.
Thank you, Ronnie. Yes, these slides will be available on our website. And given that some of these changes were in the last several hours, we have not gotten them translated, but as soon as we have them translated to our top 5 languages, we will also have them available on our website. So yes, they will be available on the website for people to be able to download. Thank you, Ronnie. I think this is a perfect transition point for us also to move on to the next topic. Dawn, just want to give a huge thanks for all of the work that you've been doing with childcare stabilization grants and for coming for the last several months and answering a lot of provider questions. We know that it has been a whole undertaking. So thanks for joining us again, and we'll hopefully have you again next month.
Thank you.
Great. And with that, let's go ahead and transition to some agency and program updates. Alyssa, if you can please join us again and walk us through some of these most recent updates. Thank you.
Thanks, Karina. Yeah, so wanted to just share some quick updates before we go back to questions. I know there's been a lot of confusion about a sprinkler rule requirement, so just wanted to update you all here. In April of 2021, the Department of Consumer and Business Services adopted rules that required new registered and certified family providers to install an automatic sprinkler system in their facility, or work with their local building official on using an alternative. We heard from you all, from partners, that we were not seeing any alternatives approved by local building officials. All the alternatives were very costly, as were the sprinkler systems themselves. So we worked really closely with the Department of Consumer and Business Services to do some joint temporary rulemaking on January 26th. So both of us adopted rules that allow alternatives to the sprinkler system. DCBS, the Department of Consumer and Business Services, their rule that they adopted, their temporary rule, lays out an alternative that does not require a local building official to approve the alternative. The Early Learning Division and the Early Learning Council adopted rules alongside that around fire safety. This rule language is effective for 120 days, so until the end of May 22. We're going to be engaging in a public rulemaking process before those rules are adopted permanently. They're available on our website, but these rules factor in displaying a fire extinguisher in a visible place, having a nightlight to light up your pathway in the evening, making sure we're practicing fire drills and evacuations, really looking at things that have very minimal cost to providers as an alternative. When we do the permanent rulemaking process, we will put out a request for folks to participate in a rulemaking advisory committee, and then the Early Learning Council will adopt a permanent rule in spring of this year. Right now, the Office of Child Care is using a technical assistance and coaching approach. So we don't expect everybody to fall into compliance 1 week later. We know it takes some time to purchase carbon monoxide detectors, to start practicing your drill and evacuation protocols, to post your evacuation routes. So we want to make sure that you all have an opportunity to come into compliance during this temporary rule set period. We do want to note, though, that we are required to address complaints. So if a complaint is called in, we will have to follow up. But as a general rule, we are not trying to punish or take a punitive approach, but really help everybody get into compliance with this new requirement going forward. We also wanted to make sure you all could save the date. Our goal is to keep these sessions going every month through this year. And so our next session is scheduled to happen on March 1st with a Spanish session on March 2nd. And we plan to talk a lot more about what the rulemaking process looks like in that meeting. So we hope to see you all there as well. And I'll turn it back to you, Karina.
Thank you, Alyssa, for that information. And I agree, we're excited to continue to do these information sessions. Hopefully they are of help in some ways. And we just also encourage you to encourage your colleagues and peers to join us. It's great to see several folks here tonight. We do have about 5 minutes left, and just seeing the influx of questions, I would like for us to take, even if it's 3 minutes, to answer a few more of these. We'll go ahead and answer some of the most upvoted questions. Ronnie, would you like to facilitate us through this? And
Sure, thank you.
I'll let you cue us out as well.
Thank you. So I think this question is from Miriam. Miriam, is there a plan to put together an updated exclusion chart with the new guidance?
That's a great question. I would love to work with Oregon Health Authority to put together some more tools for childcare providers, and we've been having conversations about it. So that is a goal.
Thank you. I think this question is for Dawn. Dawn, do you see any other financial support coming down?
You know, currently I'm not aware of any. You know, I think the one area is looking at Build Back Better, but we also know that that's kind of maybe hung up. It hasn't passed yet. But I am not aware of any new funding coming in to the state. I don't know if Alyssa has any thing to add.
Yeah, thanks, Dawn. There is a package that will be considered this legislative session. The legislative session started today. It goes through the first weekend of March. And there is a request for $100 million that has several components. It would increase the subsidy rate reimbursement for ERDC. It would also provide some funds to communities to increase capacity, so to expand existing childcare programs or stand up new programs. So if those funds are approved through the legislative process, there may be an opportunity to see some dollars that way. The last part I'll mention, and again, this needs to be approved by the legislature. This package includes wage enhancements for providers. Currently, I believe the package has it at $500 per person who is involved in a childcare setting. That would be administered through Portland State University. So we're crossing our fingers. We're hopeful to see that money move forward. And if that is something that's approved by the legislature, we will share more information at our March session.
Thank you. So I believe this is for Miriam and our OHA staff. The new guidance says 5 days if all the group are masked. Does that mean that children are actively wearing them except for when eating or resting? Or can it be that all children are encouraged to wear them, realizing that some may refuse? And of course, this is about children 2 and up.
Meg, do you want to take this one? Do we still have Meg on? Maybe not. Or Niti, are you? Okay. So
We have Niti, but she might be in
Sorry.
meeting.
Yes, I am unmuting myself. So yes, as much as possible, the kids are highly encouraged to mask, especially if they are of that masking age. Sorry. And I think recognition by, the providers, if there are, kids who are refusing masking, to kind of identify that before and maybe talk to them or educate them about alternatives in terms of the mask that they can wear, and if it's easier to use, and provide some more education maybe around that. So I think the bottom line is that ideally it should be preferred that everybody is masking at all times, and then those decisions should be made accordingly.
Okay. I am trying to find this one here. I'm
Thank
sorry.
you, Ronnie. I see the next question here, and I'm happy to read it. That might be our last one for the evening. It says, just a sentiment. I spoke with OHA and ELD certifier and the Multnomah Health Agency. Everyone gave me different answers to my COVID questions, and it appeared that no one was on the same page. With these new rules, will we see more continuity amongst other agencies with similar guidelines and rules?
yeah, so when the CDC changed its investigative guidelines, or its quarantine and isolation guidelines for the general population, it did not update childcare sector guidance. And so that's where you saw local public health and ELD guidance conflicting. We were still saying 10 days, or OHA was still directing childcare 10 days, while the rest of the population, except for different sectors, we're seeing then 5 days. And so now that the CDC has updated its childcare sector guidance, you should see better alignment between the instruction that you're given by local public health and what Oregon Health Authority has presented tonight.
Thank you, Miriam. I just want to go ahead and say thank you to everyone who's joined us tonight: Dawn, Miriam, Niti, Meg, Alyssa, and all of our folks in the background as well from the ELD. And more so, thank you to all of our providers, health professionals, and everyone who has joined us on this webinar. We know that there are a lot of unanswered questions still, and that these changes are difficult for us at times, especially when things continue. COVID is still rampant, and we're just trying to adjust, recognizing that we will be impacted by COVID for some time to come. So with that, we just want to give again thanks. You will see a survey pop up if you are logged in on Zoom. If you are on Facebook, we will go ahead and drop a link in the comment section there as well. Your feedback is helpful for us to help facilitate these webinars and information sessions in the future, and an opportunity for us to hear some of your questions and comments. So please go ahead and fill that out. It's really helpful for us. You will be able to access the recording of this webinar on our Facebook. It is currently being streamed live, but you will be able to see it there as a recording, and on our website as well, including the slides. So if you want to have access to these, please look back tomorrow, and the slides will be uploaded to our website. Again, thank you everyone so much for joining us, and we look forward to having you in March. Thank you.